Question 1. Which physiological response is typically seen in the compensatory stage of shock? A. Tachycardia and increased respiratory rate. B. Decreased blood pressure and bradycardia. C. Warm and dry skin. D. Hypoglycemia and bradypnea. Answer. A. Tachycardia and increased respiratory rate. Question 2. What is the most appropriate position for a patient experiencing hypovolemic shock? A. Supine with legs elevated. B. High Fowler's position. C. Prone with arms above the head. D. Semi-Fowler's with knees flexed. Answer. A. Supine with legs elevated. Question 3. In managing a patient with shock, which task is most appropriate to delegate to a licensed practical nurse? A. Administering prescribed 4 fluids. B. Interpreting arterial blood gases. C. Titrating vasopressors. D. Initiating central line placement. Answer. A. Administering prescribed 4 fluids. Question 4. What is the primary purpose of administering crystalloids during initial shock treatment? A. Restore intravascular volume. B. Reduce cardiac workload. C. Treat infection. D. Prevent arrhythmias. Answer. A. Restore intravascular volume. Question 5. What is the earliest indicator of poor tissue perfusion in a shock patient? A. Altered mental status. B. Decreased blood pressure. C. Cool extremities. D. Weak peripheral pulses. Answer. A. Altered mental status. Question 6. What is the nurse's best action when a patient receiving dopamine reports chest pain? A. Stop the infusion and notify the provider. B. Reassure the patient and continue the infusion. C. Administer a prescribed opioid. D. Raise the head of the bed. Answer. A. Stop the infusion and notify the provider. Question 7. Which assessment finding is consistent with the progressive stage of shock? A. Cold, clammy skin, and hypotension. B. Warm extremities and normal urine output. C. Increased alertness and bounding pulse. D. Mild tachypnea and pink skin. Answer. A. Cold, clammy skin, and hypotension. Question 8. What is the best method to evaluate the effectiveness of fluid resuscitation in a shock patient? A. Monitor urine output. B. Measure capillary glucose. C. Assess for pedal edema. D. Monitor sodium levels. Answer. A. Monitor urine output. Question 9. Which electrolyte imbalance is most common in early shock due to fluid loss? A. Hypokalemia. B. Hypernatremia. C. Hyperkalemia. D. Hypocalcemia. Answer. A. Hypokalemia. Question 10. A patient with suspected cardiogenic shock is dyspneic with crackles. What should the nurse do first? A. Place the patient in high Fowler's position. B. Increase 4 fluids. C. Lower the head of the bed. D. Administer potassium. Answer. A. Place the patient in high Fowler's position. Question 11. What does cool, pale, and clammy skin in a patient suggest during the early stage of shock? A. Peripheral vasoconstriction. B. Adequate tissue perfusion. C. Neurogenic response. D. Reduced oxygen demand. Answer. A. Peripheral vasoconstriction. Question 12. What should a nurse assess first when a patient on vasopressors develops pale, cold fingers? A. Perfusion to the extremities. B. Infection at the foresight. C. Pulse deficit. D. Oxygen saturation. Answer. A. Perfusion to the extremities. Question 13. Which intervention is priority when caring for a patient in obstructive shock from cardiac tamponade? A. Prepare for pericardiocentesis. B. Administer 4 antibiotics. C. Elevate the lower extremities. D. Apply warm blankets. Answer: A. Prepare for pericardiocentesis. Question 14. What is the nurse's most accurate indicator of tissue oxygenation in shock? A. Serum lactate levels. B. Systolic blood pressure. C. Capillary refill time. D. Skin color. Answer: A. Serum lactate levels. Question 15. What is the best indicator that a patient with septic shock is improving? A. Urine output of 30 ml per hour. B. Temperature of 102 degrees Fahrenheit. C. Blood pressure of 90/50. D. Skin remains cool and mottled. Answer: A. Urine output of 30 ml per hour. Question 16. Which action can the registered nurse delegate to an experienced, unlicensed assistive personnel caring for a shock patient? A. Obtain and report hourly urine output. B. Assess for signs of decreased perfusion. C. Titrate for vasopressors. D. Educate the family about prognosis. Answer: A. Obtain and report hourly urine output. Question 17. A patient with burns is showing signs of hypovolemic shock. What fluid is most commonly used first? A. Lactated ringers. B. Dextrose 5% in water. C. Normal saline with potassium. D. Half normal saline. Answer: A. Lactated ringers. Question 18. Why is oxygen administered to a patient in all types of shock? A. To maximize cellular oxygenation. B. To decrease metabolic rate. C. To lower carbon dioxide levels. D. To reduce blood viscosity. Answer: A. To maximize cellular oxygenation. Question 19. Which condition most likely leads to obstructive shock? A. Tension pneumothorax. B. Hyperthyroidism. C. Myocarditis. D. Hypoglycemia. Answer: A. Tension pneumothorax. Question 20. A patient in shock has a central venous pressure of 2 mmHg. What does the nurse anticipate? A. Hypovolemia and need for fluids. B. Fluid overload and diuretics. C. Normal volume status. D. Need for vasodilators. Answer: A. Hypovolemia and need for fluids. Question 21. What is the most appropriate nursing action when a patient in septic shock develops new confusion? A. Assess oxygen saturation and blood pressure. B. Request a psychiatric consult. C. Dim the lights and allow rest. D. Administer anti-anxiety medication. Answer: A. Assess oxygen saturation and blood pressure. Question 22. Which finding in a patient with neurogenic shock requires immediate action? A. Bradycardia and hypotension. B. Warm, dry skin. C. Inability to move lower limbs. D. Pink mucous membranes. Answer: A. Bradycardia and hypotension. Question 23. A patient in anaphylactic shock complains of a swollen tongue and hoarseness. What is the nurse's priority? A. Prepare for intubation. B. Administer antihistamines. C. Check blood pressure. D. Insert a Foley catheter. Answer: A. Prepare for intubation. Question 24. Which finding is most consistent with the refractory stage of shock? A. Multisystem organ failure. B. Mild anxiety and restlessness. C. Normal cardiac output. D. Increased urine output. Answer: A. Multisystem organ failure. Question 25. A patient receiving vasopressors via a peripheral for complains of burning at the site. What is the nurse's first action? A. Stop the infusion immediately. B. Flush the 4 with saline. C. Apply a cold compress. D. Elevate the arm. Answer: A. Stop the infusion immediately. Question 26. Which clinical sign indicates that a patient in shock has progressed to the irreversible stage? A. Severe hypotension unresponsive to therapy. B. Mild confusion. C. Elevated temperature. D. Rapid response to fluids. Answer: A. Severe hypotension unresponsive to therapy. Question 27. What complication should a nurse monitor for in a patient with septic shock receiving large volumes of four fluids? A. Pulmonary edema. B. Renal failure. C. Hyperkalemia. D. Hyperglycemia. Answer: A. Pulmonary edema. Question 28. What is the purpose of measuring central venous pressure in a patient with shock? A. Evaluate fluid volume status. B. Detect cardiac ischemia. C. Assess pulmonary function. D. Measure electrolyte balance. Answer: A. Evaluate fluid volume status. Question 29. A patient is at risk for hypovolemic shock after surgery. Which symptoms should be reported immediately? A. Decreased urine output. B. Blood pressure of 120/80. C. Respiratory rate of 16. D. Pulse rate of 78. Answer: A. Decreased urine output. Question 30. Which assessment supports the diagnosis of anaphylactic shock? A. Wheezing and stridor. B. Clear lung sounds and bradycardia. C. Warm, dry skin. D. Blood pressure within normal limits. Answer: A. Wheezing and stridor. Question 31. Which action is a priority when preparing to administer vasopressors for shock? A. Ensure patency of a central venous line. B. Start a peripheral 4 with a 22-gauge catheter. C. Administer a loading dose of diuretics. D. Monitor blood glucose level. Answer: A. Ensure patency of a central venous line. Question 32. What nursing diagnosis takes priority for a patient with decreased cardiac output due to cardiogenic shock? A. Ineffective tissue perfusion. B. Impaired physical mobility. C. Risk for impaired skin integrity. D. Disturbed body image. Answer: A. Ineffective tissue perfusion. Question 33. A patient with suspected shock has a serum lactate of 5 mol per liter. What does this indicate? A. Impaired tissue oxygenation. B. Good tissue perfusion. C. Normal metabolic function. D. Renal compensation. Answer: A. Impaired tissue oxygenation. Question 34. What is the most appropriate way to assess a patient's response to norepinephrine infusion? A. Monitor blood pressure and urine output. B. Check pupil size. C. Measure blood glucose levels. D. Perform abdominal assessment. Answer: A. Monitor blood pressure and urine output. Question 35. What is the nurse's priority action if a shock patient becomes unresponsive and pulseless? A. Begin cardiopulmonary resuscitation. B. Administer epinephrine. C. Call the patient's family. D. Recheck for responsiveness. Answer: A. Begin cardiopulmonary resuscitation. Question 36. Which condition is most likely to cause hypovolemic shock? A. Severe gastrointestinal bleeding. B. Myocardial infarction. C. Spinal cord injury. D. Allergic reaction. Answer: A. Severe gastrointestinal bleeding. Question 37. Which lab value should be monitored to detect disseminated intravascular coagulation in a shock patient? A. Platelet count. B. Creatinine. C. Sodium level. D. Hemoglobin A1C. Answer: A. Platelet count. Question 38. What is the best nursing intervention for a patient showing early signs of anaphylactic shock? A. Administer epinephrine as prescribed. B. Apply cold compresses to the rash. C. Encourage oral fluid intake. D. Instruct the patient to lie flat. Answer: A. Administer epinephrine as prescribed. Question 39. Which action is most appropriate for a nurse when caring for a patient in distributive shock? A. Monitor for warm, flush skin early on. B. Limit for fluid intake. C. Place patient in prone position. D. Apply ice packs to extremities. Answer: A. Monitor for warm, flush skin early on. Question 40. A patient with shock has jugular venous distension and muffled heart sounds. What is the nurse's first action? A. Notify the provider about possible cardiac tamponade. B. Increase the fluid rate. C. Perform a chest X-ray. D. Reposition the patient. Answer: A. Notify the provider about possible cardiac tamponade. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!